Everyone to the last PALS session for the academic year and the second last pathology rounds for the year. I'm really excited about today's topic. We're fortunate to have two speakers that I've seen give a mini presentation on this topic, but I'm really excited to see the full presentation. Our two presenters are Dr. Joy Masuhara, who's a family physician here at VGH, but is also taken on some leadership roles in EDI as the EDI medical director, and also is the uh, um, regional medical, basically for EDI regional medical director for Vancouver Coastal, and then also is the co-chair for the medical staff EDI committee. And also Angela Gray, who is actually comes from a more communications background and works as a culture consultant and facilitator. And so we're going to get a 2-for-1 deal, and both of them are going to present to us on bias in healthcare. And normally when we think of bias in healthcare, we think of it from the kind of medical research lens, things like selection bias, confirmation bias, measurement bias, publication bias, but this is going to deal with more of an interpersonal professional lens for bias. So welcome, Joy and Angela.
Great, thank you. Thank you, Tyler. And we can go to the next slide and welcome everybody. And we're so, Angela and I, really happy to be here today. Can we go? Yeah. So this is the territory acknowledgement, and I'll just say I'm actually coming from the Clayoquot First Nation. I'm over in Tofino right now, and I'm always amazed when I look at this map of our province of how many First Nations are actually represented here in this province. This month, June, is National Indigenous or First Nation Indigenous History Month, and tomorrow is the 21st of June is National Indigenous Peoples Day, and there'll be many activities around the province that you may be able to take part in if that's something you're interested in doing. We can go to the next slide.
I can use my mouse here.
Oh, right. I'll hand it over to Angela.
Thank you, Joy. So thank you. I just want to acknowledge that I'm calling in actually from the traditional territories of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations. So really grateful to be here today and be able to share a bit about what Joy and I do together, have the privilege of doing this facilitation with Joy. When we do work like this, we just want to set things in a good way. Just thinking about why we're here and supporting us and leaning into the content that we'll present today. Sometimes it's a bit uncomfortable. Sometimes when we present this work, there's some ouch moments, but we really want folks to just really lean into our curiosity about learning, curiosity about other perspectives, and curiosity within ourselves around maybe we can shift our lens a little bit, shift our worldview about things. And while we do that, having a sense of compassion for ourselves, because this journey, when we think about EDI or anything related to it, we have to come from a lens of compassion because we're all going to make mistakes. Joy and I have been doing this for a long time, and we continue to have discussions about the mistakes that we make. And so having a lens of compassion with that sense of curiosity and bringing in some courage to share your perspective when you can, and be okay with other people not agreeing with that perspective. And having courage to, as introverts, I'm generally sit as an introvert, so it's interesting that I do facilitation work, and I've had to learn to have courage to speak. And I've also, in that process, have learned that people that tend to be a little bit more extrovert need to have a bit of courage not to speak and bring space for others. And while we do so, doing that with a sense of confidentiality, that anything that's shared here stays here. We ask that folks take the learning, but the stories to keep to yourselves.
I think you're dealing with mostly introverts, Angela. Although there
So,
might be a few extroverts in the mix, but mostly introverts.
I'm in good company then. As we lean into new learning, um, we always situate in ourselves with this sense of comfort. We're comfortable in not learning. We're comfortable with the familiarity. We're comfortable with doing things or thinking about things in the way that we've always done. And so what we're trying to move folks to is really getting into the space of learning and growth and really leaning into that courage and that curiosity that I mentioned previously. And being curious with ourselves when we hit this fear zone. And the fear zone really is we've taken in new content and then we can become a little bit rigid with our ideas. And it's like, well, I can talk about pronouns and my discomfort with using pronouns. So I've had to learn. My name is Angela J. Gray. I use the pronoun she, her. But 10 years ago, 8 years ago, I wasn't using that. And then when it came into my workplace and folks were challenging me around, well, Angela, why don't you're an EDI person. At that time, we were talking more about social justice. Why don't you learn more about pronouns and why people use them or not? And so I had to lean into my fear and my rigidity around that. As a cisgendered woman, it didn't seem to matter to me. And then I had to lean into learning, lean into my own curiosity, lean into my bias. So, which is what we'll be talking about, leaning, where do these biases come from? Why did I not want to learn about this? Why did I not think it was important, even though it was work that I was doing? And as I engaged in with my own curiosity around myself and my own discomfort, I was really able to settle into, okay, I'm going to make mistakes. I'm going to get people's pronouns wrong, but it doesn't mean that I don't try. And it doesn't mean that I don't try to learn and to improve where I can. And that's where we come into this adaptability and this openness around that self-compassion. We're going to make mistakes, but maybe we can lean in a little bit more to being open and curious about other people's perspectives in different worldviews. So in the spirit of today, our hope is that folks will gain some understanding about the difference between conscious and unconscious bias. Um, Joy will lead us through a discussion around and some information around what we're conscious and unconscious, what it is, how it's formed. And then we'll think about how it shows up. When do these biases show up? And how we can lean into an understanding of what our intentions might be and what the impact might be. And that's that space of compassion for ourselves and others. And then some ways and strategies to mitigate some of those biases in the workplace. We know currently that there's around 180 different biases that show up. We're only going to talk about 6 of those today that are more common in the workplace. I'm going to hand it over to you, Joy.
Sorry, or unmute first. Okay. Thank you, Angela. So, yeah, what is bias? We pretty much put them into 2 different types, conscious and unconscious. So the conscious ones are the ones that we know about. We can express them fairly directly, and then unconscious bias is really the ones that are hidden, and these occur very very quickly. That we know they're kind of our autopilot. I'll talk a little bit later about how they're formed, and they include things like not just whether you like something or not like something, but things around assumptions, beliefs, attitudes, and stereotypes are a type of bias as well. And they can be about individuals, or they can be about groups of people. And I think the main thing here about bias is that we all have them. they're just there. They form at a very young age. They're not necessarily good or bad. Sometimes they may have good impact. Sometimes they may have impact that's not so good. And those are the ones that we want to be careful about, particularly when they're unconscious. Um, so, we get into, particularly with unconscious biases, really sort of cognitive habits. And these are things that we want to be able to identify and then be able to change if we can, particularly if we're seeing that those biases are having some negative impacts to those around me. So as an example of, say, a conscious bias, for me, I know I have a bias towards watching movies that are in English rather than in languages with subtitles, because I'm lazy and I don't like having to read subtitles. But I'm likely missing out on a lot of really good cinema. And when you think about how we frame cinema or film, and we think about how it can other when we use words like foreign language films. And it's a foreign language, in when you're in a dominant culture where English is the language, is the dominant language. But anywhere else, it may not be foreign. But that word "foreign" others it. And if this is just an example of the Academy Awards. Until 2020, they were still calling it the award for the best foreign language film. Now they're calling it best international feature film, as a way of changing the ways in which sort of bias enters. Um, so the unconscious bias is all that stuff that shows up and we're unaware of it, as I mentioned. And one way to become a little more conscious of it, there's this the Harvard implicit association test. Some of you may be familiar with this. You can take it. It's free. You can they have a whole bunch of sort of different categories that you can take the test on. And again, my own example, I consider myself fairly unbiased when it comes to gender, particularly, but doing the test, I repeatedly end up showing gender bias, and which is really annoying. But it really shows how hardwired some of this stuff is. And part of it is about, the time period I grew up in and just all the other things around me that have contributed to those biases, which I'll talk about if we go to the next slide. These are how biases sort of come to be, and also very importantly reinforced. So our upbringing, socialization, I mentioned, I still on these implicit association tests show a gender bias. I grew up in in a home where my mother stayed at home. She didn't work outside the home. Fairly patriarchal cultural background, and in a time where I'm probably a lot older than many people here. So in a time where the gender stereotypes were quite strong. So community relationships, so that's who's around you, what's your cultural background, who's your family. Those all influence all of our own experiences and experiences of others that we know about. Those can contribute to biases that are formed. Institutional influences. Education, of course, is a big one. As I mentioned, a lot of these biases, they start happening very, very early on. So things that happen early on in our lives are the things that kind of get stuck there. And then media, literature, all of those things have a huge amount of influence on unconscious bias and also reinforcing biases. So if you think about when you grew up, what you saw on TV, what you read, what stories were told to you in your family, these are all the things that influence. There's this thing called, if we think about media and books and movies, etc., there's this thing called the Bechdel test. Some of you may be familiar with this, and it rates the characterization of women in film. It came about actually out of a cartoon. It was kind of a joke, but then it became this thing that people started applying to movies and seeing that, oh boy, this is really this is really not so good. So the test has these three criteria. Um, where you either get a good rating or a bad rating. And so if you get a good rating, if at least two women are featured, they must have a conversation with each other and discuss something other than a man. So that's the Bechdel test. And it was surprising at the time. I think this came out in the 80s. It was surprising how many movies actually failed the Bechdel test. And then Gina Davis, who's an actor, created an institute really looking at the portrayal of women in media. And things are changing, and they've refined the Bechdel test as well, so that there's other things that are looked at, such as race, etc. But it really showed that that media can be a really strong influencer on our unconscious biases. So one of the strategies I know that UN Women was taking to counteract some of these biases, they partner with Procter and Gamble, who are a company that makes a lot of household products, and they wanted to work with them to change their advertising so that the portrayal of men and women in terms of work in the home was changed. So they started having their ads that had way more men in the ads working alongside the women, or men alone, like doing dishes and doing laundry and all those types of things. So these are the ways that we can start to change some of those stereotypes and some of those biases that end up getting very set into our unconscious. We'll go to the next slide. So the outcome of biases, this is what is important. We mentioned that, we're all going to have biases. They're not inherently good or bad. It's just really their impact that we need to consider. These are just, a few things when we create, sort of a positive versus a negative binary with our biases, that they can actually have some negative impacts. In healthcare, we know things like the report, the in plain sight report, that biases can result in inequitable healthcare and outcomes and a poor patient experience. So again, in healthcare, it can be really important that we notice where bias shows up. These other things, outcomes, association of, who we just consider to be credible. I know I have this bias, when we see resumes, or, we hear about people, oh, they've gone to, some noted university, you just give them more credibility. Or someone with a PhD is also obviously going to be smarter than you with your, and just your MD degree, or whatever. And these again are just some of the outcomes when we think about our biases. The next slide. So this is a really important concept when we're considering bias, because again, when we say this is an automatic response, often we don't even know it's happening. And our intent wasn't, to wake up in the morning thinking, okay, what kind of, harm can I do today by unleashing all of my biases, all of my unconscious biases. We don't do that. We don't intend to cause harm. But it's kind of like, accidentally stepping on someone's foot. We didn't intend to do that, but it still caused an injury. And we still need to understand and acknowledge that harm was done. So that impact is always something that we have to really take note of. And it's not negated by having, not by having either good intention or not having bad intention. not meaning it, it doesn't negate the impact. We still have to think about that. And each of us, will have our own window of tolerance for harm, and which can vary from day to day, can even moment to moment. And we don't know what this is for any individual. So really being able to listen and acknowledge people's experience can go a long way in just mitigating any unintended harmful consequences, of our unconscious bias. I'll just pause there for a minute if there's any questions about anything that we're going over this pretty briefly. Angela's going to talk a little bit more about specific types of biases. But Angela, do you have anything to add to the things I've just briefly gone over?
I think you're on mute. Oh, there you go.
Yeah, thank you. Yeah, I just want to highlight a couple of things. It's really important around the window of tolerance. And also, if we can't look inside ourselves to give ourselves a bit of compassion while trying to understand the other person's worldview, it makes it much more difficult to give meaningful apology. So this work is not easy. So I just want to offer a space of grace as we're developing these concepts and taking them in. Because what tends to happen in this work sometimes is that we take all this information and we go to 100 and then we make a mistake and we don't want to carry on. So it's really important to have that compassion as we go along and understanding that sometimes when we do make amends, people may not accept it. So we do want to honor that space, and the best we can do is forgive ourselves and move on. I just want to offer that as well.
But yeah, I think those really good points, Angela. So I'll pass it back to you now, I think.
So I mentioned earlier that there's about 180 biases. And biases, and we'll talk a bit about how they tend to show up. But they are really from those those early days of our lives. And they're going to pop up in different ways. And one of the things, there's a study done, and there's been thoughts done around, it takes about 40 attempts to change a habit. So if we think about, I think about for myself, I had an injury a couple years ago, and I'm not a gym person. I like to go for bike rides. I like to dance. But I don't necessarily like going to the gym. And so I've had to practice. It took me months to get into a regular routine to do these rehab exercises to strengthen my body. And just to take in that into other areas of our life, that understanding that it takes some time. And they're also thinking about mitigating bias by it being a cognitive behavioral strategy. And so thinking about the thought and thinking about what the behavior is, and then thinking about what the outcome is so that we can change our behavior. So when we think about the different types of biases, some of the ones that show up more commonly in the workplace are things like affinity bias. And this is the one bias that is very common, and that we want to highlight because we tend to, as human beings, and a part of our survival mechanism, we tend to want to be around people that are like us. It comes from our old brain. And so it's in us. And so it's natural to want to gravitate towards people that are similar to us. So I'm a mother. I might have more of my friends actually tend to be other parents than folks that don't have children. And so we tend to do that. But what happens is if we apply that behavior towards, say, our workplace, we may exclude people. We may choose certain people to go for lunch with and not get to know other folks. It could reflect in how we do hiring. We might have an affinity towards people that went to the same high school or the same university or does similar things. So what we want to think about is how can we shift and reflect on the circles that we're in, and in particular in the workplace. How are we doing hiring? Who are the people that are common to us? who are the people that we will promote alongside of us because they're like us. And so we need to sort of think about those similarities and how we're excluding folks. Um, some of the things that come out that we find also is this confirmation bias, which is a tendency to seek out and prefer information that supports our pre-existing beliefs. So what that looks like practically is um, if I am if I see another person of color, and I might make assumptions about them because they have a certain hairstyle, but that may not have anything to do with who they are. But there's media that has portrayed this idea. There's books that I read that has portrayed this idea. So how do I shift my belief about a person, about a culture, about a community? I need to expand my lens. I need to go to that community, attend their events. It's like Natural Indigenous History Day tomorrow. I need to make an active decision to change my lens or change my viewpoint about Indigenous brothers and sisters, right? So when's the last time have I changed my point of view? And another thing that kind of happens in the workplace is attribution bias. And so we tend to brush off or explain some of these behavior based on their character rather than something that might have happened. So I remember several years ago, I was a solo parent and I was struggling with my son. And so I was showing up to work a few minutes late, trying to get him off to school. And so there was ideas about me based on that, but folks are about my commitment to my work, about my belief in the work that we were doing, all of these things. But in fact, there was a situation that was precipitating my behavior. And so we might want to think about how can we be more empathetic and compassionate towards folks and using that, shifting that worldview about what we think might be happening to what could be happening. It's sort of like from a trauma-informed perspective. Instead of saying, what's wrong with you? We might want to shift our language to what happened to you and bringing that compassionate voice in. Just want to pause there. Joy, do you have any thoughts, or anyone in the room, any thoughts?
I mean, Angela, to Joy's point earlier, I guess part of it is like these aren't necessary. Like I keep my bias is I keep struggling by being judgmental towards biases and thinking they're all negative, but I'm keep having to remind myself that this is just something that, we all do and we all have these tendencies and they're not necessarily kind of positive or negative. I mean, they can be positive or negative in their impacts, but yeah, because even some of these like affinity bias can work in a positive way too, like in terms of camaraderie, morale, and other things too, like in terms of like, treating your colleagues, you know, in a positive light. But yeah, I think these are kind of things that I think it's just maybe even just good to think about and maybe reflect on our own experiences with them. Is that fair to say?
That is absolutely fair to say. I do think it's really important to understand that all biases aren't bad. And it really is about what the impact might be on somebody else or the research that you're doing or that shifting of that worldview. It doesn't cause anybody any harm when I choose to hang out with my friends that have kids, right? But what the harm could be is if I go into my workplace and I ignore the people that don't have kids, right?
Yeah,
That's where the impact shows up,
yeah,
right?
that makes
No,
sense.
nobody cares that I don't like turn up, right? But because it doesn't harm anybody. And so that's why we want to think about these biases. And I'll talk a little bit more about where they might show up and where we might want to think about it a little bit more. But I really like your points there.
Yeah, I'll just also add, it's in terms of trying to catch your own biases is asking yourself, particularly around certain types of decision making, just asking yourself, is there any am I bringing any of my own biases into this decision? Um, And yeah, just doing a bit of a scan that way. Sometimes like they're so buried that we don't notice them, and they're just so present in our kind of social environments, uh, that sometimes we can totally miss them. So that's when the tools like the implicit association test can kind of help us find out, oh, I seem to have a bias this way. And then once you kind of notice it, you start noticing it more and more. It'll come up, and you got, catch it. It'll be easier to catch, because they're really hard to just erase completely. You really have to work at it. But noticing it and then doing that little cognitive work, cognitive behavioral, moment with it, can really help to mitigate. And then always kind of challenging yourself and being curious about it.
Yeah.
And being okay with those days where you don't want to do that work at all.
Yeah, exactly.
I also see there's a comment in the chat, asking kind of in a way, taken away from if it's you personally, but more if how do you maybe engage other people? So the question is, what is the best way to engage people who have strong biases in a constructive conversation about the consequences of their action, and not strengthen their unconscious bias into becoming like kind of more solidified? And it also says, because now you have brought up a potential weakness in them, and the individuals with the strongest biases in the workplace may not attend these kind of educational sessions, which is interesting.
Yeah,
So
so I do appreciate the realness of that question, because it is difficult to engage folks that you see the bias and the harm that bias can have. So, some of the strategies that we talk about are, how do we call in and call in people or call out people, depending on the situation. So, and there's a whole course on calling in and calling out. So I'm just going to go through it really quickly. But when we think about it, if somebody's bias is showing up in a space and it's visibly harming somebody, you can see it, there's psychological harm happening in that in real time. Um, that's a time where if you have the capacity within your own nervous system to call them out, and to do it in a way not to shame, but to say, hey, ooh, that's an ouch moment, or oh, that didn't really land very well with me. Can you explain to me what you meant by that when you said that thing? Um, if that's not comfortable, you may wish to make note of it, check in with the person that's being affected by it, so make sure that they're okay, and then call in that person at another time privately. Again, the purpose isn't to shame them. It's not to bring up their nervous system. It's just to say, I noticed this. This is what my experience was. Where were you coming from when you said this? This could have been, this probably was, this likely could have been the outcome or the impact of that. So it's, and these things take time and strategy to develop. I'm not a person that typically calls people out. I have stronger leanings towards calling people in. So I will check in with the person that might be harmed, and then I will reach out to the person afterwards and say, I noticed this thing. And also in doing this work and doing that, it's, whether you call in or call out doesn't necessarily mean that the person's going to receive it. So you do need to be okay with the fact that they may not be okay with being with that being noted to them, and check in with yourself around what your nervous system is feeling like. Joy mentioned the window of tolerance earlier. We all have a sphere of our window of tolerance, and what that means is there's a space where we operate in a good way. We can handle stress, but when we get out of that space where we can handle stress and we move into this place where we're either hyper aroused or hypo aroused, that's really not a time for us to be calling in or calling anybody else out, because our nervous system isn't regulated enough to show up in a good way to do that, regardless of how we might experience or feel about that person.
yeah.
So
Yeah, and I like how you're kind of focusing on the ouch, like the fact that somebody was impacted by it. So you're not really getting caught up in the weeds of what's the right thing to say or whatever, but more just like, looking out for those around you and basically speaking up if you see somebody's impacted in a negative way.
Yeah, yeah. So three more of the biases that we thought we share today. Halo bias. This comes up a lot in the workplace. And what this really is that we tend to judge or perceive people on the things that we see them do really well. It's like we might have seen somebody do this thing so well that they end up getting these secondments or opportunities because of those two or three things that they've done well. And there isn't an evaluation of that person or that person's work through the scope of what they've done. And that can happen in the opposite way which is called horn bias, where somebody has done, as I mentioned earlier, a couple of days, they've come into work later, they haven't been themselves in the work environment. And that reflects on them in a way that suggests that they can't do their job or they're not worthy of a secondment or another opportunity. So we really need to think about slowing down and collecting second opinions. When biases show up in the workplace, really leaning into other colleagues or your peers around, I have this idea, I have this thought, can I check this out with you? Can you help me sort of flesh out what my biases might be or what the biases might be showing up in this space? So really thinking about collecting that secondary information. So conservatism bias it's very similar to confirmation bias, but it's really thinking about preferring existing evidence over new evidence or new research that's come into the foreplay. It's like me doing EDI work when 5 years ago there was only 130 biases, and now they say there's 180. And how do I think about that? How do we think about mitigating bias differently? So being able to lean into new ideas and being able to really lean into that space of curiosity when our fear shows up and our belief systems that show up that say, no, don't do it. Don't read that new work. And that's really about our comfort, remaining in that comfort place for ourselves. So how do we shift from that with that sense of compassion? And then the hypo bias, which is very common in structured organizations. We live in this world, right? This is a world that we're all swimming in. So it's really difficult sometimes to challenge the viewpoints of the highest paid person in the room. And so really what that means is that the organizations need to encourage folks to share their ideas in a safe way. So it's really thinking about leaning into psychological safety so that we can have open conversations around biases that might show up and the opinions that might be at play that are harming and not instead of helping. So I'm going to stop there before we get to our case study. Are there any thoughts, reflections, Joy? Do you have anything to add? Tyler, you had some great points there and there as well. Other folks?
Nothing to add, but I do think it'll be interesting to try to remember these 6 as we go through maybe some of the examples you have.
So we're going to have an open discussion. We have a case study. Oh, actually, before we do that, we might want to talk about when they show up. So just a quick note. We are most likely to cause harm through unconscious bias when we are tired. Like it's just when we're tired and when we're hungry and when we're stressed, our brain is really trying to it's trying to categorize and catch the information that is known to us. And that may not be in a good way. So my example of that, and that's, it took a lot of work, is coming home from work and coming home from a stressful day and coming home to a kitchen that's dirty. So my mother was very, very much that the kitchen had to be clean. It didn't matter what time of day, that's how it had to be. And so I carried that into my relationship with my son, that the kitchen had to be clean when I got home from work, not thinking that he's coming home from school, he's hungry, he might have some friends over, they're eating, and that should be okay. So I had to engage in changing my habits. So that 40 times, not going in the kitchen, going into my room, changing out of my work clothes, washing my face, doing that stuff, calming my nervous system, going into the kitchen and saying, "Hey, Wes, can you help me clean up here a bit while I get dinner?" Which was much healthier than what was coming out of my mouth earlier. And so, really thinking about when they show up, it's situations that are ambiguous. So, if we don't have the information, if we don't have enough information in a complex situation, we may want to shortcut our brains to going back to conservatism, going back to confirmation, rather than looking at the situation more holistically. So this is the time when we want to engage in second opinions. And then, as I mentioned before, not challenging power structures, which is difficult. You know, that's it's real. It's difficult. So how do we create a culture together around making it safer to challenge viewpoints that may not be in the best interest? So we have a case study here. I'm going to read this out, and then Joy is going to read out some of the questions that we have in relationship to it. So um, this is really a workplace situation. You are taking a break in the staff lunchroom, and one of your lab technician colleagues comes into the lunchroom looking quite distressed. They are relatively new to the team and have a lot of experience from their work in the country they recently immigrated from. You know them to be a competent and conscientious worker. The technician speaks with a mild accent, but you have never had trouble communicating. You ask if they are okay, and the technician breaks down in tears, saying they were yelled at by one of the staff on the ward where they were collecting specimens, as it took them quite a while to get there after some of unavoidable delays on another unit. They related that this staff person is often abrupt and today blamed your colleague in front of a patient for delaying their treatment. Hand that over to you, to Joy, to read.
Okay. Um, and just another comment about the time when bias particularly can show up, and if you think about those three things that Angela mentioned, stress, conditions where there's ambiguity, and where there's power dynamics, a hierarchical structure. Well, this sounds like our healthcare system. So it's no wonder that bias can really show up in our healthcare systems. So when you think about some of the biases we talked about, if you think about this scenario, what might be happening? And feel free to write things in the chat. If you would like to put your hand up and speak up, that would be great. And again, we're all being compassionate and courageous and confidential and all of those things here. So however you would like to participate is fine. And if you want to, just do some own self-reflection, that's totally okay as well. This is all in a spirit of trying to learn and try to learn together. So does anyone want to put either in the chat or speak up about what types of biases might be happening in this scenario?
So one thing that I think people in lab medicine might be sensitive to is there often is a bias that some of the frontline healthcare workers sometimes feel like the laboratory staff don't actually care about the patients because they're not right there at the front lines as much. And so, that clinician who's kind of berating the lab staff about delaying treatment is kind of also kind of maybe betraying a bit of a bias that, the lab staff don't actually care about patients as much as maybe the frontline healthcare workers.
Yeah, there's absolutely, that power dynamic, or a perceived, even if there isn't actually a perceived power dynamic, like you say, of the positionality of a lab technician versus someone on the frontline staff.
There's some good points in the
Yeah,
chat. Yeah.
yeah, attribution bias for sure. The hippo bias. Yeah, it's likely that whoever I don't know what the pay grades are for people in the lab world, but we know even without that much difference in pay, if you think about uh, doctors, whether we feel the power or not, we will still have power in the eyes of others. So we always have to kind of remember that in our interactions with others. Um, and what might be happening that might increase the chances of bias playing a role here in this scenario.
Well, you mentioned the speaking with an accent, so there could be some biases towards that person's country of origin or ethnicity.
Yes, absolutely. So those types of biases. Also, what we talked about, those things that make it easier for bias to sort of uh, show up.
Stress,
Stress, absolutely.
being behind schedule.
Yeah.
Yeah.
I think especially too with so many moving parts in healthcare. Like, we'll have our technologists going to the bedside to collect a bone marrow biopsy specimen, but the patient's off in radiology getting a scan done. And so there's often all these, you know, interacting parts that can, interfere with each other and make everybody irritated.
Yeah. Yeah. So the more there's stress and and we hear about all of the um you know over overextended everybody in healthcare and how that ends up playing out in terms of bias showing up, um, disrespectful behavior showing up. These are all ways that stress and that also the ambiguity. Here's maybe someone that the staff person is worried about because they don't really know what's going on. That's why these tests are being done, et cetera, et cetera. So there may be some ambiguity going on as well. Um, that's basically a day in the life in our healthcare system. Um, so going on to the next sort of few questions. In your imagination, in hearing the scenario, when Angela's reading the scenario, did you assign a specific gender or race or ethnicity to the lab technician? And what were they? And you can, again, if you want to speak up, fine. If you don't want to, that's fine too. And if you want to put anything in the chat, that's good. I think we did this purposefully to have gender neutral language in the case study. We didn't identify race, ethnicity. We just said that it was an immigrant from a different country, and they had a bit of an accent. So yeah, when you know from your lived experience, right, that most of your lab technologists are going to be women. So you imagined a woman. So
Yeah.
you
I
assign them the gender. It's based on lived experience.
I did the same. And if I'm being honest, part of it also was the fact that the technician became emotional.
Yeah,
And I think I have a bias there to
yeah,
picture that person as female.
yeah. That's a really common bias for us to, it's one like through our own experience and what we've been taught, boys don't cry, all of those things that end up in our gender stereotypes. So it's really easy to go to an assumption and a stereotype about the lab technician. Now, if you think about if this lab technician was a man, would it change how you would view the scenario?
As folks think about that, Krista, I see your hand is up.
Oh yeah, I mean, my comment was going to be right before you asked the question. I also thought that they were likely female because that they're less likely to receive respect on the wards as much as a male lab technologist would. So that's why I thought possibly that they were female as well. I don't think my opinion would change if this was a man versus a woman or non-binary lab technologist. But
Yeah, that's a good point, Krista. And also see in the chat, for to play devil's advocate, Loudon also kind of said she actually pictured a male because she said most of the lab techs with accents in her lab are male actually. So it's not it's interesting how like I think you have to picture something in your head when you read this story. And it's nice to see that not everybody pictures the same thing.
And I think how it would change is that like I almost would felt more sorry for the female if it was a female in a situation, but like, oh, that's terrible they picked on you because I know that on average women are less likely to sort of stand up for themselves. Whereas if it was the male that I was originally picturing, I might kind of be like, oh, well, gee, like that's awful, but like, why didn't you say something or stand up for yourself? Or just like, I might have less compassion in the situation because I'm like, well, you should have been confident enough to, stand up for yourself or something like that. So my expectations of the person do become different.
Yeah, it's really interesting how we, and this is all a part of our own unconscious biases. So noting them, and like I said, it's neither right, good nor bad, or but it's just good to really note them, because when they come into play and they are having some negative impact, that's when you want to be able to mitigate them as best you can. Um, what I didn't ask this question, but what about the staff person that did the yelling? Uh, any thoughts about did you imagine them in a certain role or a certain gender or age or ethnicity?
Okay.
100% female. Pictured a nurse. Busy nurse.
Mhm.
Yeah, because the doctors are never on the ward, right? That's just a joke. Um, Men less likely to get emotional and yell. Uh-huh. Okay. Cheryl, you can go ahead and ask your question.
Thanks so much, Joy. This has been really, really, really interesting. I would like to just shift the perspective just slightly. We've been addressing, biases that we kind of grew up with and historical things that are, evolved in the past. But I think what we're witnessing right now, and I can speak from experience on this, is an evolving geopolitical new bias that is driven by a lot of things that are happening across the border, including things like NIH no longer enabling foreign subcontracts. And I can see in my colleagues that now they have to toe the party line, but they're starting to believe what they have to write and read and say, which is it only counts if it's done in the USA. And I'm really struggling to react against that and not evolve a bias against the American arrogance that I see growing every day. And I'm wondering if you and Angela might have some comments on how we can deal with not only the biases that we kind of grew up with, but the ones that are threatening to emerge as additional biases on top of everything else that we're dealing with.
Yeah, I have a couple of thoughts, and then Joy, if you want to jump in.
Sure.
Okay. I think that our biases also reflect from what our values are. So when there are new situations or evolving situations that come into play, we have to we do need to we need to reflect on what our values are and whether our values need to change and so or need to shift. And so while we reflect on our values, we go back to the same mitigating strategies around what could be the bias that is showing up in this present moment, this present situation. How does that relate to what my values are in terms of what I believe or how I operate in my life? Because sometimes our biases aren't reflective of what our values are. And that's another case study within itself. So it's really thinking about what those values are, how they're showing up, how am I operating with them, and what are the biases that are impacting them or not. That's one space. And then when is it more likely for those biases, these evolving biases should show up? Is it when we're fearful, right? Fearful of speaking up. We might lean into that space. So, going back to that space of curiosity and courage and self-compassion for ourselves when we may not operate in the way that we would like to as human beings.
I appreciate that, Angela. I would love to, follow up a little bit offline with this. Just, building on this, I'm seeing it harder to align. So my values are to supply very good quality work. Within this current situation, for example, we were told, or we are encouraged by one of the American institutions, that we were too good, that we had to kind of dumb it down to make the Americans look better, kind of by comparison. And that is, against my values of the honesty and the integrity and the quality of the work that, my team has produced on this international project. I cannot say yes to, we will kind of not say what we have done very well. So that's been a struggle of how I'm trying to operate by my own values, and yet I have to fight for the survival of my team that has, put so much work into this, and so on. And so what I'm struggling with is that the need to act in various different ways, to maintain good relationships with my colleagues, um, but also, just being so aware that we're, I think science and the integrity of research and evidence-based approaches is increasingly under threat.
Yeah, I do agree, Cheryl, that it is a larger conversation, and
Yeah.
I would like to have it out offline. I think some
Sure.
of the things that I'm hearing beyond the value and what the work is the ethical and the moral distress around what's
Mhm.
happening.
Yep.
And so for those reasons, I think having a larger discussion with folks that are from ethics as well might
Mhm.
be helpful. So if we can connect offline, I'd really like that.
Sure, sure. And I raised this because I know I'm not the only one struggling with these changes in the international world. And, I'd be happy to have an offline conversation with you, but if we want to come back, say next year, and have a more discussion about, the relevance of being aware of how the geopolitical situation, the funding, the access to care situations might be starting to clash with some values. How do we operate in the most ethical way and unbiased way going forward?
Yeah, yeah. It is definitely a larger conversation. So
Yeah.
yes,
Yeah.
let's please connect.
So I know we only have a few minutes
Yeah.
left, and yeah, that could be another very interesting
I
conversation.
agree.
So thank you for bringing that up. And I know there are people in the sort of, because EDI is certainly under attack right now as well, and so there's lots of discussions happening in the sort of EDI world around, how to maintain values within the geopolitical context right now. The last question here was, and maybe people can go away and think about this. How would you respond to your colleague in this situation? I'm not sure that we have a lot of time for discussion about it because I think we're over time actually.
Yeah, over time. And we never do this, so thank you.
Yeah. And I'm worried the recording might stop at a certain point, so we probably should kind of wrap things
Wrap it up. Okay. Well, we'll leave that as a, reflection question for people to go away and think about. And
So we do
and
have
then
sorry,
yeah.
I'm cutting off just in interest of moving forward. We do have a couple resources. We will share this live, so there's lots of reading here if you wish.
Yeah, that'd be great.
And a couple things to think about in terms of macro and micro incidents in healthcare. And for folks that, like to read, there's a really great book around bias that was written by Toni Morrison called Recitative. And she's got two characters in the story, and she does not tell you which person is white and which person is black. And so all the biases around this comes up in this story, and I believe she won a Pulitzer Prize for it. And so I'll share that as well as an addition for folks that like to read.
That's great. Out of curiosity, Joy, I'm sorry if we get cut off, but I'm curious. You mentioned taking a test on gender biases or a quiz or something like that, and I was curious: are some of the resources you have? Is there anything that we can do ourselves to explore our own biases and try to make us a little more aware of some of the ones we might not be aware of?
Yeah, so the implicit association test through Harvard, I think if you just Google Harvard IAT,
Okay.
you'll get to their website, and they have all sorts of different types of categories that you can test yourself. And it really gets to your unconscious by the way they've put the test together. So,
Yeah.
even if you think I'm not biased about that, you come out of it going, oh my goodness, it's all there. It's all
Yeah, I
there.
think it's more
Yeah.
Yeah, exactly. I just want to be maybe a bit more aware of some of the ones that I'm not aware of.
Yeah, yeah. So you can just take whatever category, you
Yeah.
think and try it out.
That's great. There's been a lot of positive feedback in the chat, and I want to thank both of you for a really interesting, enlightening talk. And I'm sure we could have a lot more Q&A, but I think maybe I should, in the interest of time, wrap things up. But thank you for your time, and thank you for sharing your slides as well.
Thank you.
Yes, thanks for having us.
All right. Happy Friday, everyone.
Take
Thanks.
care. Bye.